we achieve range of motion. I mean much faster. But in certain cases, we will not be able to follow the standard protocol because the patient or each patient will be different, and because of the pain threshold or because of the health or because of the age, okay, it will be different. So, but still, I prefer to have a standard protocol because the pace we can adjust later after making the standard protocol, and then based on their patient tolerance or the type of technique what we have used or the implant they have used, based on that we can adjust the pace of the protocol.
Thank you, ma'am. As ma'am has articulated that, of course, the standard, the protocols which are there, which will guide us to decide upon our protocols, but there are some situations where we could vary our protocols, change our protocols according to the patient needs. Thank you, ma'am. And the next question would be, as we know that, of course, the interesting topic lined up by elite panelists who are going to speak on this TKR. We know that in today's world, the robotic TKRs or minimally invasive TKRs are in demand, and different implants which are there also showing us that it can have a lot of impact on the recovery of our patients. So I would like to know from Dr. Narsinga Rao sir that how much should rehabilitation progression change depend on surgical techniques or implants what we use? So what is your take on the robotic surgeries, how we rehabilitate patients, robotic surgery or different techniques, what recent advances have come down? So I want you to elaborate on this, sir.
Good evening all. As we know that surgical procedures, we have conventional procedures and also computer assisted, robotic assisted procedures, and also minimally invasive procedures. I think from long days we were using the regular conventional rehab protocols for most of the TKR procedures. And now I think we have come up with the latest robotic assisted procedures, which is less tissue damage and also less blood loss, and also faster healing, the tissue healing. So where the patients will go in the faster healing phase. So our rehab protocols also is being changed drastically from conventionally what we were using it. And definitely the physical therapist has to adapt the changes, the progression of the protocol from conventional to the advanced. So I think currently we have seen a lot of evidence-based practices. So we are using, for example, earlier we used to see that wound healing which is to take the longer time. So now I think from the day when we are starting the rehab protocol, and prior to that also we need to educate the patient pre-operatively so that we can get back the patient into the normal within short span of the time. So as Madam said, that is a standard and versus individualized. So there's a lot of differences. Standard, as Madam said, like keep on, we were using it. So individualized, I think we need to focus on patients, what requirement there. So based on that, then we can plan it, and we can get, because each patient is different. It is not similar protocol. So it depends on the patient requirement, then we can modify the protocol, and we can get back such patients into the normal pace easily. So here similarly, I think we need to concentrate more on the faster recovery, and depends on the patient, because younger patients who are more active in the sports are more stronger early phase itself. But older people, I think we need to concentrate on the age comorbidity elements and all. So definitely, which is drastically changed from conventional to advanced progression.
Thank you, sir. As sir has narrated that TKR with robotics assisted operations and things like that. So probably if you do a extensive literature search, it's still lacking like the protocols for robotic assisted surgeries. Probably that could be an area where the lot of research could happen. So where a lot of evidences can come up regarding how we can rehabilitate differently, or how can we progress this patient from phase 1, phase 2, how we can have an aggressive rehabilitation with this kind of approach. Talking about in literature, we have a lot of the progression in literature. What is available is progression depends on the criteria, not time based. Like probably an individual to move from first phase to second phase, it could be a 2 different patients, could be taking 2 different time period. So in this regard, if you had to define 3 non-negotiable, if you have to define 3 non-negotiable evidence-based criteria to progress from early to mid-phase rehabilitation after TKR, what they could be. I would like Dr. Preeti Surana ma'am to take up this discussion. What are the minimal criteria to progress in rehabilitation stage?
Good evening, everyone. I think the 3 non-negotiable criteria for progression. One will be your knee range of motion. You should have achieved at least 90 degrees of flexion and full extension or minimal lag for us to progress further. Second one would be having good quadriceps activation, quadriceps strength. So they should be able to do a SLR without any extension lag. And third would be pain and mobility. Pain, let us say in our scale of 0 to 10, it should have come to at least 4 or less for us to progress further. And mobility is, yeah, with less assistance, they are able to move around. So progression should be criteria based rather than time-based.
Yes, ma'am. As you rightly said about a point about quadriceps activation is a very important aspect of how we progress. That is the first thing what doctors once the patient come back to seeing into how much progression he has made. They think about the knee extension, whether there is a lag or not, or whether the quadriceps is activated or not. So, are we doing enough in our rehabilitation to properly activate, or what are the strategies which we can follow to properly activate this quadriceps muscle, which is very important to take the load. So I would like Dr. Narasimha Rao sir to talk about how our physiotherapists are doing enough to early activate the quadriceps, and what are the strategies.
I think we have seen in our practice, day-to-day life, post-TKR, the quadriceps weakness, which is a main factor which is influencing for patients to get back into the normal. So I think we need to focus more on quadriceps activation even before a patient is undergoing for surgery. I think we need to educate preoperatively such patients. It could be younger patients or older people. So we need to see that what exactly the strength has such particular patients. So based on that, we need to assess and see that post-op, immediately after surgery, the patient has to get back into the normal without any weakness. So I think this weakness, quadriceps weakness, we have seen plenty of cases, and we need to focus more on this so that we can prevent the quadriceps weakness, and regular exercises which can be taught to the patient, which can incorporate it, like quadriceps stands, sets and heel slides, SLRs, all these kind of exercises which we can incorporate and strengthen the quadriceps. So even post-operatively, I think earlier we can prevent by incorporating into aggressive rehab protocol. In the sense, I think within 24 hours we can start with quadriceps sets. So based on that, I think we can make such patients to come back to the normal life, and we can prevent quadriceps weakness with that.
Yeah, definitely supporting. Also, we can look into kind of biofeedback for quadriceps stimulations, or kind of functional electrical stimulations.
And also, neuromuscular electrical stimulation, one more modality which we can incorporate for the activation in this.
Wonderful. Thank you, sir. And now I would also like our panelists to talk on this point where many patients holds back either because of fear or pain. We are not able to, make out whether he's really having pain or he feared of some, movements or, is he not that confident? So in this regard, clinically, how do we differentiate patients who genuinely cannot progress from one who is simply fearful or poorly motivated? Motivation of patients also is very important aspect of our rehabilitation. So I would like to ask Dr. Ajita ma'am to talk about this. Fear versus real tissue time, healing time, or pain. So what do you think is holding back our patients for early rehabilitation?
Actually, we should identify, what is limiting them, like, from the physical limitations, from psychological barriers like fear, or, some people, they may think that it may open up because of that. Also, the future may open up because of that. Those kind of issues, they may, they may not do the exercise properly. But the reassurance and educating them definitely will help them to achieve the goal, and we can achieve whatever target we have.
Thank you. So that's what it becomes very important that we motivate our patients, we talk to them, we find out about their challenges, how they feel about, how they go about this rehabilitation period. So that becomes an important